Students, the lecture today is about hypersensitivity reaction part 2. We will discuss hypersensitivity type 3 and 4 and the additional types. Here are some key definitions will be mentioned through the lectures. The learning objectives of the lecture, we will discuss type 3 hypersensitivity immune complex mediated, mechanisms leading to acute inflammatory reactions, factor influence the tendency of immune complexes to develop disease, and the important role of RBCs in clearance of immune complexes, locally formed immune complexes, circulating immune complexes, systemic. Example of immune complex hypersensitivity caused by viral infection, type 4 hypersensitivity, cell-mediated delay type, and hypersensitivity type 5, stimulatory hypersensitivity, and innate hypersensitivity reaction. Type 3 hypersensitivity immune complex mediated. The body may be exposed to excessive amount of antigen over a period of time as a result of persistent infections, autoimmunity of cell component, repeated contact with environmental agent. Antigen and antibody complexes within the body may give rise to acute inflammatory reactions through a variety of mechanisms. Mechanisms leading to acute inflammatory reaction. When macrophage when complement activation, complement bind to immune complexes. It's just like opsonine will bind in that case with Fc gamma receptor of macrophage, leading to pro-inflammatory cytokines, interleukin-1 beta, tumor necrosis factor, reactive oxygen intermediators, and nitric oxide. In that case, increase the killing capacity for macrophage. Or the complement, these complexes will lead to platelets aggregation and vasoactive amines, microthrombin, local ischemia, low blood supply, and low oxygen in that case. Or while complement activation leading to C3A and C5A release, these factors will activate mast cells and leading to granulation. Or also, complement may proceed to C5b, 6, 7, 8, and 9 polymer to form formation, membrane-attacked complements, leading to cell lysis. Also, other mechanisms that complement activation leading to C5a. C5a will attract neutrophil. Neutrophil we called frustrated phagocytosis. Release of granules containing local tissue damage will occur. What is the frustrated phagocytosis? Occur when phagocytic cells are exposed to an opsonized surface, from here C5a, spread as if trying to engulf it, allowing for the observation of phagocytic spreading and the biochemical event that directly preceded. All these mechanisms leading to acute inflammatory reaction. Factor influence the tendency of immune complexes to develop disease. First, size. The size of immune complexes. Very large complexes or complexes with many free IgG-Fc region, that means antibody excess, are rapidly removed from circulation by macrophage in spleen and liver, therefore usually harmless, while the most pathogenic immune complexes are small or intermediate in size and found during antigen excess. They are cleared less effectively by phagocytes, therefore circulate longer in the body. The charge of the complex, the valency of antigen, the avidity of antibody, hemodynamics of a given vascular bed, localization in kidney and joints is explained by the high hemodynamic pressures associated with the filtration function of the glomerulus. In that case, all these factors affect the mechanism. The important role of RBC in clearance of immune complexes. Covalent attachment of C3b to immune complex prevent FC-FC interactions. These receptors cannot interactions between required to form large insoluble aggregates, and these small complexes bind to CR1 receptor, the complement receptors on RBC, and are transported to fixed macrophages in the liver and spleen where they are safely destroyed. Now, if there are defects in this process, deficiency in classical pathway component, or perhaps if the system is overloaded, then widespread disease involving deposition of these complexes in kidney, joints, skin, and choroid plexus will be may result. Now let's stop on choroid plexus. It's a network of capillaries in the walls of ventricles in the brain, and this will be affected by immune complex in that case. Locally formed immune complexes. The Arthus reaction. Arthus found that injection of soluble antigen intradermal in the hyperimmunized rabbit with high level of precipitating antibody produced an erythematous and edematous reaction, reaching a peak of 3 to 8 hours and then usually resolved. The lesion characterized by intense infiltration of neutrophils, injected antigen precipitate with antibody too fast for the classical complement system to prevent it. Subsequently, the complex is able to bind complex by using fluorescent reagents to demonstrate antigen, immunoglobulin, and complement component in this lesion. It's possible to do that. Now, variants of Arthus-type reactions. The reactions are first to inhaled antigen Farmer's lung. Farmer's lung hypersensitivity pneumonitis, immunologically mediated inflammatory disease of the lung involving the terminal airway. It is associated with intense or repeated exposure to inhaled biological dust in that case. To resident infection, elephantiasis, also known as lymphatic filariasis. It's if the living Wischiaria and crofty are relatively harmless, but the dead parasite found in the lymphatic vessels initiates an inflammatory reaction thought to be responsible for the obstruction of flow of lymph in that case. To release microbial antigen in the skin of Lepromatous leprosy after treatment with chemotherapy. In syphilis patient receiving penicillin and rheumatoid arthritis, where complexes formed locally in the joints due to production of cell associating IgG anti-IgG by synovial plasma cell. Circulating immune complexes are systemic. Example of disease resulting from circulating immune complexes, immune complex glomerulonephritis, small complexes reach the epithelial side, whereas larger complexes retained in or on the endothelial side of glomerular basement membrane, and as it's shown in this figure. Example of immune complex hypersensitivity caused by viral infection. Dengue hemorrhagic fever. Dengue shock syndrome occurred during a second infection with dengue virus. As far as there are 5 types of virus, antibodies that have been produced to one type during the first infection may not neutralize the second strain, but facilitated its entry into and replication within monocyte macrophage by attachment of immune complex to Fc receptors. Now, type 4 hypersensitivity, cell-mediated or delayed type. The best known example is Mantoux reaction. Mantoux reaction obtained by injection of tuberculin. Tuberculin is an extract of Mycobacterium tuberculosis bacteria into the skin of an individual in whom previous infection with Mycobacterium had induced a state of cell-mediated immunity, characterized by erythema, redness, induration, hardening of the tissue, which appear only after several hours and reach a maximum at 24 to 48 hours, thereafter subsiding. Histologically, earliest phase of the reaction seen as prevascular coughing of blood vessels with mononuclear cells, followed by more extensive exudation of mono and polymorphonuclear cells. Polymorphonuclear cells soon migrate out of the lesion, leaving behind mononuclear cell infiltrate consisting of lymphocytes and cells of the monocyte macrophage series. The cellular basis of type 4 hypersensitivity. When macrophage present the antigen peptide combined in complex with MSC class II to memory T cell, CD4 T cell, CD4 plus T cell through binding with T cell receptors. This leads to activation and proliferation of CD4 T cell into differentiation into T helper 1 or T helper 2 or T helper 17. These types will secrete interleukin 4, interleukin 5 to activate eosinophil. Eosinophil will be degranulated and release histamine and leading to tissue damage. Also, T helper cells will activate cytotoxic T cell. In case of T helper 1, 2, or 17, these cells will secrete interferon gamma, interleukin 17, leading to activation of macrophage, which present the antigen peptide to memory T cell, CD4 T cell, to increase the capacity of killing of these macrophage, either through fusion to make a giant cell. Giant cell is large number of macrophages fuse to form multinucleated macrophage, referred to as giant cells, leading to forming chronic granuloma, or the macrophage will have the increased capacity of growing and form epithelioid cell. Epithelioid cell is a macrophage that differentiate to morphologically resemble epithelial cells. Giant cell and epithelioid cell will be included with the structure of chronic granuloma. If virally infected cell display the antigen peptide combining as complex with MHC class 1 to CD8 plus T cell. CD8 plus T cell will differentiate and activate to be cytotoxic T cell. Cytotoxic T cell increase the cytotoxicity and leading to killing the virally infected cell, leading to tissue damage in that case. Examples of disease caused by tissue damage by type 4 hypersensitivity, infections, tuberculosis, leprosy, measles, many infections, viral infection, fungal parasitic disease, inflammatory bowel disease, Crohn's disease, ulcerative colitis, sarcoidosis, contact dermatitis, psoriasis. Now, hypersensitivity 5, type 5 stimulatory hypersensitivity. It's similar to type 2 hypersensitivity in that it is due to antibody to cell surface antigen, but in this case the antibody do not mediate their effect via cytotoxicity to that antigen, but rather are directed to a cell surface receptor and act as agonists, leading to stimulation of the cell, like in hyperthyroidism, in Graves' disease, preeclampsia, and hypertension, leading as cause of this kind of agonist antibody. In Graves' disease, now, in normal situation, the thyroid stimulation hormone will bind to thyroid stimulation hormone receptor, leading to stimulation of thyroid cell to secrete and synthesize thyroid hormone. Also, there's a regulated production of thyroid hormone through a negative feedback control by pituitary gland. This is in normal situation, while in Graves' disease, the autoantibody bind to thyroid stimulation hormone receptor, leading to stimulation of this receptor, continuous stimulation of this receptor, leading to activation of thyroid cell to produce and synthesize thyroid hormone with uncontrolled production of this hormone, leading to hyperthyroidism. There is no negative feedback control in that case. Innate hypersensitivity reaction. Some infections provoke a toxic shock syndrome involving excessive release of tumor necrosis factor, interleukin-1 beta, interleukin-6, and activation of alternative complement pathway. Also, acute respiratory distress syndrome associated with the gram-negative bacteria, lipopolysaccharide endotoxin, provoking a massive invasion of the lung by neutrophil. For example, a gram-positive bacteria cause release of tumor necrosis factor and macrophage migrating inhibitory factor through direct action of macrophages and stimulation of selected T cell families by the enterotoxin superantigens. Operation of innate mechanism may underlie idiopathic pulmonary fibrosis. A rule of 4 innate responses has been proposed as contributory factor to the pathogenesis of Alzheimer's disease. Thank you very much.